Ця подія є абсолютно унікальною, і я думаю, що пошук нових IT-рішень для України є просто питанням номер один в 21 столітті.
We often say that the future of health is digital. It's true, and the next 40 hours you will be part of shaping it.
Країну змінюють люди. Для того, щоб змінити країну на краще, потрібно мати ідеї. Одні люди мають ідеї, інші люди вміють реалізувати ці ідеї і доводити їх до пуття.
Ми розробляємо нові продукти діджиталізації, які допоможуть стати кращою нашій медичній галузі.
Thanks to the hackathon, today we bring together the bright minds of the health and IT sectors.
Це унікальна можливість для учасників протягом активної роботи 48 годин напрацьовувати діджитал-рішення, які орієнтовані на людину та збереження і зміцнення її здоров'я, на сімейного лікаря як ключового партнера для людини у промоції здоров'я, профілактики хвороб, а також у супроводу лікування і, зокрема, для впливу прийняття кращих рішень для професійного розвитку, професійної спільноти, а саме сімейних лікарів, саме як потужного потенціалу систем охорони здоров'я, які просувають доказові практики та мають людино-орієнтований підхід.
Тому це суперкрута подія, і я дуже радий бути експертом, я дуже радий ділитися своїм досвідом з учасниками цього хакатону.
So this hackathon is really a great opportunity to bring together experts from various fields in healthcare, industry and IT.
Ідеальне місце, щоб проявити себе або пропагувати свої ідеї по покращенню медичних послуг глобально.
Теза сьогоднішнього воркшопу про те, що потрібно закохуватися в проблему для того, щоб могти її вирішити. Мені приємно знаходитися в такій атмосфері. Ти не тільки генеруєш свої ідеї, а ти заряджаєшся цією атмосферою.
Ідеально було б зробити кльовий продукт, який змінить саме Україну і стан здоров'я в нашій державі.
Бажаю успіхів усім командам. Будьте рішучі, сміливі і креативні у своїх рішеннях.
Innovate and invest time for future Ukraine and improvement in health.
Ми точно не очікували виграти. Моя думка була, що ми не зможемо конкурувати з 40 класними проектами, реально класними. А сьогодні ми виграли.
Моє шанування.
Hello. I welcome you at the second health hackathon for WHO in the European region. It's a pleasure to see the organizers and participants smiling in the video we've just seen, because this shows inspiration, positive emotions, and hopefully those who are with us today, you have a lot of things ahead of you, lots of creative, brave work, lots of creative solutions. Thanks to them, you will be able to win. I am sure that you are the best specialists in your field. You are ready to innovate. You are ready to support life, because health is the sector which supports life. Round of applause for yourself for participation in this second health hackathon. And of course, we need to be more energetic. I wish all the teams to raise hands. Okay. And who is here for the second time, maybe? Yeah? Welcome. Round of applause for you. warm welcome to those who have been to our events before. You are experienced, but of course, everyone has a chance. Everyone can make it to the top 3 because the brave ones will win. And yeah, the teams that have been here, please welcome the ones who are here for the first time. So, yeah, right now let's get a round of applause from everyone, those who have taken part for the first time and for the second time. Okay, great, great, great. So, as a moderator, I will focus on the importance of atmosphere because brave solutions are about freedom. Freedom is about emotions. Emotions are about creative thinking. So this atmosphere will surely be helpful. Please be ready to be brave, to think out of the box, to come up with innovations because creativity and bravery, that's the key to progress, and this is something of crucial importance for the hackathon. Those who are with us online, well, let us also join this atmosphere. And another round of applause for those who are joining us online at the second Health Hackathon 2024. Thank you. And we are going to begin right now. This is the second Health Hackathon in the European region, second largest one in Ukraine, supported by Harvard Health System Innovation Lab. Round of applause to them. And also, very importantly, in these difficult times for Ukraine, it is important to affirm life. We are here to find new solutions in the field of health, and this is worth a lot. A round of applause for the organizers and the participants who are here to contribute their creativity, their ideas, and to affirm life. Right now, we will have a video welcoming word from Dr. Viktor Leshko, the Minister of Health.
Нерозривними поняттями. Розвиток цифрових рішень не лише пріоритет уряду, а й один з основних трендів розвитку систем охорони здоров'я на світовому рівні. Рівень впливу діджитал-сфери на розвиток і покращення надання медичної допомоги аж ніяк не менший, ніж розвиток, наприклад, фармакології чи будь-якої з медичних наук. Фахівці різних сфер і професій можуть пропонувати і допомагати розвивати цифрові рішення в сфері охорони здоров'я. Від порівняно простих застосунків, що допомагають нам слідкувати за власним здоров'ям, рівнем цукру в крові, чи виховувати
Пан Ляшко, він говорив про те, що інноваційні рішення, вони надзвичайно важливі, тому що вони масштабують.
The idea is that innovations are important because they are scalable. They are here to scale the healthcare solutions, and this is the way to expedite treatment and care for one's health. So there were technical issues, and well, we will maybe try to attempt this again. And we also have a welcoming word from Natalka Tsmot, the ambassador of Canada.
Я Наталка Цмоть, посол Канади в Україні. Good afternoon and thanks for joining the Health Hackathon in Kyiv. Ukraine is one of the partner countries funded by Canada to strengthen primary healthcare systems. We promote universal health coverage to ensure that all individuals and communities receive the health services they need without suffering financial hardship. This access includes a full range of essential quality health services to improve overall health outcomes for all Ukrainians. We are pleased to partner with the World Health Organization in its delivery of people-centered health care. Canada is also prioritizing Ukraine's need to strengthen the mental health system. We recently signed a 5-year agreement with the World Health Organization in Ukraine to scale up community-based services in the areas of mental health and psychosocial support. Digitization is also critical to improve health systems. The COVID-19 pandemic and the war have demonstrated an urgent need for practical digital tools. Thanks to the Hackathon for bringing together the bright minds of both health and IT professionals to work on better solutions. Dear participants, thank you for being in Kyiv today. I wish you a very successful Health Hackathon. Please be bold and creative. As part of the global progressive community, you're gathering now under the umbrella of the Harvard Health Systems Innovation Lab to find new solutions. Good luck.
We are grateful to Ms. Natalka Tsmot, and right now let us welcome the participants who came here from all around Ukraine, and I will be grateful to you for the support of every city, because every city is strong, brave, and important today. So, dear participants, thank you for being here. Thank you for sharing your creativity and experience and addressing the cases we present to you. So, this is the second Health Hackathon happening here in Ukraine. The first one took place in Lviv, and warm welcome to the team from Lviv. By the way, you can also stand up and we can see where you are in the room. So another round of applause for the team from Lviv. Welcome, welcome, welcome here in this hackathon. Round of applause for Ivano-Frankivsk. Participants from Chernihiv. Chernihiv, this is a round of applause for you. Now Ternopil. You are so unique. All the applause are for you. Rivne City. Poltava. You are next. Round of applause for you. So Zaporizhzhia is a strong iron city. That's a round of applause for you. Participants from Ulster, round of applause. Welcome. The city of Bucha, warm welcome. Ladies and gentlemen, let's welcome the team from Kharkiv, another very strong city. Thank you for taking part today. Also, as usual, we have the locals, the team from Kyiv. Round of applause. Thank you. So, you can feel this atmosphere. You got a chance to see each other once again, and hopefully you can remember where the guys from Kiev are because, well, it does make sense to have someone in Kiev. Okay, so I will be expressing my gratitude to you again and again throughout these 2 days for your participation. I wish you all the inspiration. Please think out of the box. Please make sure that you come up with original solutions. They may look weird in the beginning, but they can be great in the end. So let's hear very loud applause. Thank you. So I believe the team from Kharkiv was maybe the loudest. Yeah. Round of applause once again. Thank you so much. So, yeah. Let's say a few words about this hackathon. Please raise your hand if you're here for the first time. Okay. Quite many of you. So this is the first global experience of this kind you are having. If you don't know what hackathon is, please raise your hand. I will understand that I will have to explain very briefly. So there is at least one person who wants to hear this explanation, so let it be. Hackathon is a kind of a brainstorming event to come up with some quick solutions. We will have some cases to address. You will have to come up with new brave solutions. It's gonna be an atmosphere of brave, innovative work, and we will present the solutions you come up with in the end. And yeah, I wish you every inspiration. We are gonna work non-stop, and yeah, please be as active as possible. A round of applause now. And yeah, a round of applause for the initiators and organizers. The Health Hackathon and the European region is being implemented by Harvard Health System Innovations Lab. Round of applause. World Health Organization, Ukraine. Warm welcome. The Ministry of Health of Ukraine, and also supported by the Government of Canada. Hackathon is being implemented by Civita Consulting Company, Radar Tech Innovative Company, YEP Accelerator Startup in partnership with the Ukrainian Startup Fund. Medical partners, the National Cancer Institute of the Ministry of Health, and also the Center of Endocrine Surgery of the Ministry of Health of Ukraine. We have this program arranged in such a way that you have enough time to work on your solution, to speak with the experts, to get ready for your presentation. We will have 2.5 days. Tomorrow we start at 9, and we are going to be very active. And also in the end, we will have presentations from those who are going to present your solutions. Are there any people who want to be on stage? Yeah, maybe. You will still have some time to decide who is gonna present. Also, we will have meetings with mentors tomorrow. You will get a special spreadsheet where you are going to book a session for yourself. On Sunday in the afternoon, we will have your presentations and we will select the winners. So hopefully this will be a very successful atmosphere. This room is going to be available till 10 p.m. So please make sure you are leaving on time. The prize, not everyone is aware of the prize. So the winner in every area is going to be able to take part in the Harvard Health System Innovation Lab program. The best startups will be able to benefit from the pre-acceleration program by Civita and Reader Tech. That's a creative program to give you new opportunities. And also in 3 main areas, you will have the total price of $10,000. If you are willing to win, raise your hand. And yeah, a round of applause to those who are active. Again, Nastya, our organizer, is always the most active one. So yeah, we have the total of $10,000 for the 3 winners, and we are going to work in this room. We also have now the coffee break space in the hallway to make sure that you are able to work quite actively. And yeah, here beside this hall we have a conference room for the meetings with mentors and also for some specific training events. Also in the same place we are going to have our lunches and dinners, and I'm sure that if you follow the announcements you will have a good chance to have your food. Also, we have our own Slack channels. It's very important to make sure that you are registered there. So please make sure that you are registered. The ladies over there can help you with the links, and it's important to have you there because that's the place where we're gonna share the information. Very importantly, you are now ready to work. Please get ready. We are in the meantime starting our main part of the event. We will start the presentation of our cases, and even before that, even before you learn about the cases you will need to address, let us also hear a welcoming word from Dr. Yarna Habicht from the WHO Ukraine.
I'm pleased to welcome you here in Kiev for a second health hackathon in Ukraine we are organizing together with partners. This time, we have expanded our network and are among the global hackathon hubs launched by the Harvard Health Systems Innovation Lab. As part of comprehensive WHO support in Ukraine, this event is holding the flag for digital solutions to catalyze positive healthcare changes in Ukraine and actively contribute to the digital health agenda in Europe and worldwide. We set a place where health and information technologies in a dynamic way come together to innovate and accelerate for a better future. Ukraine has made big steps towards digital transformation. It has managed to implement many changes in a comprehensive way, from government services to private sector, and including also the health. Despite the war, digital development in health continues, with recent developments in many areas we see in rehabilitation, but also how to trace access to medicines. And more promising solutions are anticipated when professionals and experts work together in competitive environment, but also working closely as a network. This year, we are doing a hackathon in collaboration with the Harvard School of Public Health and Health Systems Innovation Lab, along with the 6 other hubs in UK, Singapore, Peru, Chile, Brazil, and the United States. All hubs will be working today and over the next 3 days, focusing such challenges as mental health, cardiovascular diseases and diabetes, and cancer. All very relevant to Ukraine now. Innovations in remote monitoring, artificial intelligence, and accessible medical devices, along with policies to promote healthy behavior, are essential for management and prevention of those diseases and have healthy population. Solutions that you may develop these days could enhance healthcare systems globally and improve people's health and their everyday life. So the sky is the limit. Please stay brave, be bold, to create solutions that help Ukraine and the world. Thanks for investing your time and your talent into innovation to contribute to the future. And this helps us to set a new platforms for everybody. I wish you good luck, innovation, good thoughts, networking, being together, and breaking through with some new innovation. And most of all, stay safe, enjoy the time, and I'm looking for news, what we have innovated. Дякую.
One question here. Dear participants, dear teams, in a minute we are going to start presenting the cases that you are going to address today. Are you ready? What's your mood? Please show us with a round of applause. What's your mood? Great, thank you. In just a couple of minutes here on this stage we will have one more moderator, and it is quite logical. It's a second hackathon, so why don't we have 2 moderators to introduce the tasks to you. Let us invite to the stage Andrei Skipalski, National Non-Communicable Diseases Coordinator, who's going to present 2 areas: cardiovascular diseases and diabetes, area number 1, area number 2, oncological diseases, cancer. And also here on stage, let me welcome, or after this presentation, okay, let's do this afterwards. First, let's give the floor to Andrei. Dear friends, dear colleagues, hello. We are here at this event, and I feel almost like a VIP guest, but even though we have much time ahead, I'm sure this time will pass very quickly, and I'm honored to present to you the first 2 topic areas that have to highlight importance of why we are here and support you in the understanding of this topic and help you see the prospects. I will have just 10 slides with 2 important messages, both negative and positive things. The negative ones are about the things that are happening. The positive part is about the change we can make with support of information technology, which is right now an important part, supporting the medical interventions and helping us prevent diseases. So, cardiovascular diseases, diabetes, and cancer, right? Let me present to you this concept. So, we are dealing here with non-communicable diseases. These are diseases that are not based on any infections, but these are also the health conditions which are causing about 90% of deaths, depending on which country you are in. So the solutions in this field are going to help the health system and help the patients with their self-awareness, ability to prevent health conditions, and to be able to change their behaviors, habits, and approaches in life. So here is some context. We can see that non-communicable diseases are killing 91% of the population. They are quite often associated with some behavior and metabolic risk factors. The main risk factors are listed here. For instance, the consumption of tobacco products. Therefore, you can see many international strategies against smoking, some of them implemented here in Ukraine. Also, alcohol consumption. Again, there was a revolutionary statement a couple of years ago. There is no such thing as the safe alcohol dose. And also food. Food is becoming increasingly relevant here because there is a huge number of processing foods that is becoming part of our daily life, and this is the highest threat in terms of non-communicable diseases. And one more major factor is physical exercise. Then we have high body mass index, high glucose level in the blood, and high cholesterol level. And the challenges that exist are associated with resource limitations in the government, and our communication abilities are limited, and also prevention is not really a top priority right now, especially because of the war. We have an additional set of limitations, so this policy is not always prioritized. We are not always prioritizing health. And a few words here about the global context. We should understand that this is not only the problem of Ukraine. When the population is aging, when the quality of life is going up, we can see the changes in health. In the previous century, we had lots of successful stories with communicable diseases, and in this century we are addressing the non-communicable diseases. We have the latest data for Ukraine as of 2019, but basically the idea is more or less the same. There is preterm death that is quite widespread in men, and also there are lots of non-communicable diseases contributing to this. So if we consider these NCDs and risk factors, here is a list of the main causes of death: cardiovascular diseases, myocardial infarctions, strokes. They are ranking first. After that, we have some other health conditions, but the ischemic heart disease and strokes are the top ranking, and we can see that the most important biological factors are hypertension, food, tobacco smoking, high cholesterol level, high body mass, alcohol, glucose, etc. All of this has been confirmed through the global platforms, and the WHO is doing such work on a regular basis. And we are right now approaching the big topic of the oncological diseases. So they are ranking second. They take between 10 and 15% in the total death statistics. So, of course, the majority of death is happening because of the age-associated health conditions, but also depending on the country, depending on the income level, we have different incidence and lethality of cancer. We can see cancer ranking second, and Ukraine is somewhere in the middle. WHO points out that tobacco, alcohol, and extra weight are the key factors contributing to the different types of cancer. There is more than 100 of them. Also, there is pollution of the air among those factors, but this mainly depends on the regulations rather than on the personal choices. And you can see the percentage of different causes of cancer death: the lung cancer, the stomach cancer, colorectal cancer, breast cancer, and also liver cancer are some of the global leaders in terms of death. The good news is that between 30 and 50% of cancer is preventable if we modify behavior, if we avoid risk factors. And in the report, we can find some very basic behavior modifications. We have their weight, we have their physical exercise, the reduction of alcohol and tobacco product consumption. And finally, we have diabetes. Here, the global incidence of diabetes is about 6% of the total population. In Ukraine, we have the problem of insufficient identification of this condition, but that's a problem in many countries. So currently, the goals are to diagnose 80% of such patients. And according to different data, we have about 2 million patients with diabetes. About half of them only are diagnosed. We also can find in the STEPS report that about 30% are underdiagnosed, and that's a problem. We can also find that there are 80% of those living with diabetes have to have glycemic control in place, and also 60% of these people over 40 years of age need to get statins, and also 100% need to get access to their insulin therapy. So, a few words about the tools that are available. Let's put it this way. The creativity and your experience of the use of different IT tools can give us a huge advantage in terms of what we are able to do. So some of the ideas we came up with, different tools that could modify behaviors to reduce risk factors, help the person live with a certain health condition, etc., etc. So these tools are very important because gadgets have become an inseparable part of our life, and we are spending more time with them than the time we spend with our friends. Thank you. Thank you so much. And, well, let me add briefly once again. Thank you, Andrei, for this presentation. Well, do you have any questions? No, you don't? Okay, so then let me give the floor for the next presentation to Oleg Schultz, psychotherapist, the medical doctor and PhD of health. Oleg is gonna present the mental health support. Hello, dear colleagues. We're gonna speak about mental health. Sometimes people say that all health conditions are caused by mental preconditions. Well, Andrei has explained that there are other reasons for health conditions as well, but one of the most important factors contributing to mental health issues is stress, heavy stress. So what we are prioritizing here, the prevention of severe stress and its consequences that could contribute to the development of depression and anxiety disorders. Around the world, mental health conditions are quite widespread. As of 2019, the rough numbers were 1 in 8 people around the world are having some mental health conditions. Because of the war here in Ukraine, the chances of having such conditions are much higher. We know that about 3 out of 4 of these people with mental conditions are not getting any treatment at all, even where such treatment is available. The reasons for that are quite numerous, but one of the factors there is that sometimes the person does not understand what treatment could be effective, and we know that according to some survey in Ukraine, we learned that each month hundreds of million hryvnias in Ukraine are spent to buy non-evidence-based medications that can be not effective at all or even harmful. Also, there is a factor of stigma. We are ashamed of recognizing we have some mental health issues. We are ashamed to seek the services of specialists. The good news is that all around the world, at every level, the problem of mental health is becoming recognized and prioritized. We are hearing that mental health is a crucial component of health at large, and a lot is being done here in Ukraine as well to improve the situation. You can see some areas for the development of this area in Ukraine to destigmatize the sector, to to redistribute clinical tasks to bring care closer to the patient, to make sure that not only psychiatrists and psychologists are working to address these issues, and also, well, all the areas have to be involved, not only health sector, to put it more precisely. We are currently training general practitioners and also nurses how to identify cases and how to forward them to specialized services. Also, very importantly, we need to understand that unlike many stereotypes assume, a person does not necessarily need to get treatment in a facility. You can continue your regular life and get your mental health treatment. Also, there is a number of different guidelines that have been translated into Ukrainian. We will have some in the end of our slides, and you will be able to use this for your needs these days. And also, we are proposing here a list of possible target audiences, and we don't have the skill of taking care for one's health, and well, we have different habits such as brushing our teeth every day, but we do not have anything for mental health. Also, if we look into the target audiences, we will understand that they need to have the awareness of the evidence-based treatment methods, the different ways to develop one's resilience or stress resilience. The majority of people are facing difficulties with sleep, not only mental health patients, but just regular people, and also the family physicians who are learning this course. They are enjoying this psychosocial interventions, no pills, just communication with the patient, but overall they have only 20 minutes per patient. So again, if there were any tools to support them with their time management, being able to do more for the patient within the limited time, this would be very useful. Also, we have a new and modern service of mobile multidisciplinary teams for mental health that require services in the communities to make sure that they have inclusion in place. So we need to focus on the importance of those principles. We are striving for balance, and on the one hand we are proposing that you are as brave and creative as possible, but also please keep in mind that people with mental health issues are quite often very sensitive, and in case we are proposing anything that looks like some mental intervention, that may be harmful. We are following the do no harm principle. We are basing our interventions on the do no harm principle, and we are always comparing the costs and benefits. You know, this influence on one's psyche is quite often compared to some psychological interventions. So we need to make sure that these deep interventions the diagnosis, therapy, etc. The tools that are used in there, well, we need to understand that just like when we are doing any interventions for one's mind, these are almost the same as surgical operations, and we need to be sure that we are doing no harm. So right now, WHO has presented this smart AI assistant called Sarah. That's a tool you can use to have a conversation. So that's a WHO tool, and I work for WHO as well. So if I compare communication with Sarah and communication with a general practitioner who has been through MHGAP course, I will surely choose a real doctor. That's for sure, but we also understand that these tools can be very helpful in increasing access to services, because not everyone has their family doctors readily available. And there are certain conditions in which the person cannot safely leave home. So, if you attempt communicating with Sarah, you will understand that she's not offering any treatment. She is having a very empathetic conversation. She's providing some general recommendations on healthy habits, which are evidence-based. She is guiding you to use self-help groups and evidence-based tools. Some of the examples of the solutions are, now we need to make sure that we can be able to take part, and yeah, we need to be helpful in restoring one's mental health. We are taking care of the promotion of health. And these are the ways to simplify communication with the patient. So, yeah, confidentiality is very important, and especially in terms of stigma and associated issues. Some of the tools can be helping to see the red flags. Red flags that are not quite always visible for the person. So, if some tools are developed for diagnosis, for therapy, this of course implies the ongoing cooperation with mental health specialists, because we have to rely on research about safety and efficiency of the tools. Also, very importantly, we need to develop some interesting motivation tools to take care of one's mental health. We want to promote this idea and to start with ourselves. Thank you so much for your attention. So, we have, as you could see, very serious areas that will be important, I believe. So I wish you to be brave and to implement solutions in your work. Let me remind you, we have 3 areas to work in this hackathon: cardiovascular diseases and diabetes, cancer, and mental health support. Hopefully you can understand the areas quite well and take part in this effort. Right now, let me give the floor to WHO moderator, Dan Hertz, WHO program coordinator in Ukraine.
Good afternoon, everyone. How are we all? How's the energy? Doing better? Fantastic. So I believe now we're going to be crossing to start the link up with Harvard. Is that correct? Fantastic. So it's going to be up on the screen here. Okay. Just give us a second, everyone. I was supposed to be doing a presentation on AI and health right now, but we'll come back to that shortly, just after we get through this. Can they hear us? Yes, fantastic. Good morning, good evening, everyone.
Good morning, evening, good to see you.
Greetings from Ukraine, Kiev. Good to see everybody. Can they see?
Excellent. So, Rifat, I think we have all hubs connected.
Yep, I'm ready. Just tell me when.
So we can begin when you're ready.
Yes,
Over to you.
Well, without further ado, I will begin. Well, how so exciting is it to welcome 8 hubs to our 5th Health System Innovation Lab Hackathon. As they say, it takes a village to make this happen, and this has been an incredible effort by my team at Health System Innovation Lab, as well as many friends, colleagues, and collaborators across many countries. Before I go into the details of the hubs, I want to say a few words. And before I say a few welcoming words, I want to say a few words about the Health System Innovation Lab. So I'm going to share my presentation, and I hope this is visible to everyone. Yes. Good. Yeah. So this hackathon, our 5th hackathon, 5th in this series, focuses on building high-value health systems, harnessing digital health and artificial intelligence. And we're focusing on 3 major areas: cardiovascular disease and diabetes, cancer, and mental health, all very important areas of burden for global health that need that are in terrible need of solutions. And you can see various logos of all the collaborating institutions that have made today and tomorrow this hackathon possible. So at the Health System Innovation Lab, we research, we teach, and we innovate. We are a multidisciplinary team and international, very international in orientation and background of more than 50 individuals, researchers. We are very research active. We publish regularly in the top journals in the world. Just in the last 2-3 years, we've had more than 50 publications. We bring together, as part of our team, but also in our network, leading experts in global health systems, high-value health systems, and innovation. And we collaborate with more than 30 countries across all world regions. And we're involved in teaching 4 Harvard graduate courses and multiple executive education programs. And we've convened 5 hackathons, this being the 5th edition, since 2018. In spite of the pandemic, we're able to move forward, and we iterated and innovated in the approach that we've taken, doing virtual as well as hybrid versions. And this year, we're doing an in-person version across several countries. And in these hackathons, to date, we've tended to focus on specific areas, realizing that global health was just too big. And our sweet spot at the moment is chronic illness in relation to NCDs. And in these hackathons, we've collaborated widely, including with the private sector, with Microsoft, Novo Nordisk, Novartis Foundation, Roche, and many, but to name a few. And we've organized hackathons that focus just on the US. Then we had specific hackathons for Asia, Africa, and Latin America. And this is our global edition. And we've had more than 25 transformative ventures that have emerged from these hackathons that are currently functional. So welcome to the 5th edition, Building High-Value Health Systems, Harnessing Digital Health and Artificial Intelligence. We have eight global hubs and 3 tracks, as I mentioned, and we have more than 500 participants. We've had more than 2,000 applicants, and we had to, unfortunately, because of space constraints, narrow down the applicants to around 500. I'm going to call out each of the hubs to say a few words. But first of all, let me extend some thanks. First of all, Nur Sharar and Caroline Bolstra, along with the team, with Shay and others at Boston, who've been working extremely hard over the last few months to make today happen. In Boston, the lead was Buktavar and other members of the Jake Figgy and others who've been working very hard. In Buenos Aires, we had Andres Ananya and the team. In Kiev, Natalia Piven as the contact point and the team. In Lima and Chiclayo in Peru, Ramiro Artiaga and the team. In London, Joseph Starr and Leidu and the team. In Sao Paulo, we have FGV and Innova HC. And Adriano Masuda, Giovanna Guido, and Eriko Theodorovitz and the team. And last but not least, in Santiago, my good friends Carolina Goic, Bruno Nervi, and our team member Gabi Bor, and of course, many other team members. So I'm going to ask each of the hubs to say a few words and just to introduce themselves and wave hands. So we'll start with Boston. I'll hand over to the IT team to make the magic happen.
Boston, over to you. You can unmute yourself and introduce the team and all the participants. That'll be great.
That's why we need the digital technology and AI to make technology work.
Okay, can you hear us?
We have a ChatGPT solution to Boston.
I can hear you now.
Okay, Boston, are we online?
Hi, do you hear us?
Yes, yes.
Perfect. Yes, us here from Boston.
We're joining. Thank you.
Yeah, we're joining with over 50 people and some more coming. So thank you all for joining.
Wonderful. So I recorded the number of decibels that you generated. So that's a high bar for the rest of the hubs. So let's move to Buenos Aires.
Okay, can you hear us now?
Yes.
Okay, greetings from Buenos Aires, Argentina. My name is Francisco. I am from the High Health Hub. We are the central node for innovation in healthcare for the Austral University, the Austral Hospital, and the EI Business School. And there's more than 70 people in here participating in this hackathon. So I would like you all to make some noise.
Great. Excellent. I think that's a higher decibel count compared to Boston, but I'll ask the IT team to give the final result. Wonderful. Welcome on board, Argentina. Great to have you. So let's move to Chiclayo, our first hub in Peru.
Rafat, I think we just lost Chiclayo, unfortunately, so we can.
Okay, we can move to Kiev in that case. Let's move to Kiev, Ukraine.
Can you hear us?
Yes.
Greetings from
Wow.
Kiev. Greetings from
That's
Kiev.
an amazing setup.
Greetings from Kiev. Yeah, warm welcome from every one of us here in Ukraine. We have over 130 participants with us today, and hopefully you can see them online. A big shout out from everybody. Woo!
Hey.
And we have over 30 moderators also assisting us today. So a packed house here and very much looking forward to the next 3 days. And yeah, back to you. Thank you.
Wonderful, and welcome Kiev, Ukraine, especially in the middle of very difficult times in your country. Really appreciate your participation. So big round of applause for Ukraine, everyone. Excellent. So let's move to, I don't know if Peru is online, we'll move to Lima. Oh, Ramiro.
Thank you, welcome. Bienvenidos todos a la Hackathon de Harvard aquí en Perú. And thank you, Rika, for your presentation. My name is Ramiro Rodríguez, as I said, and we are with Jimmy Noe from Roche and Penelope Bro from Universidad Cayetano Heredia, is the Innovation Lab of the University here in
Yeah, welcome, Ramiro. Really great to see you, and great to welcome our collaborators from Peru. Let's move to London, King's College.
This is from London. We have more than 20 people here, and it's a great pleasure to be part of this hackathon.
Excellent. Thank you. Welcome. It's the first time London is collaborating as a hub, so we welcome you especially, and I look forward to seeing you later today. Wonderful. So let's now move to Sao Paulo. We have FGV and Innova 8C.
Hi. Are you listening to me?
Yes.
Yeah. My name is Erico Teodorovic. We are the hub Innova HC. We are the innovation hub of HC Hospital in São Paulo, the biggest hospital of Latin America. And we are now 108 people hungry to start.
Wow.
That's it.
Yeah. Hello, everyone. We have more than 5 rooms here. We would like to wish you a great experience on these 2 days for this innovation program, entrepreneurship program. And we want to listen some noise here, please, guys.
Great.
Thank you, guys.
Well, welcome, Brazil. Welcome, Sao Paulo. FGV and Innova 8C. We look forward to the outstanding work. So let's now move to Santiago, Chile.
Hi, Rifat.
Hey, Bruno.
We're very happy to participate this year for first time, so we thank you very much. Thank you, Gabriela, from your team, who is doing a great job. So we have near 25 very young and enthusiastic researchers, and we hope we're going to have a great time. So we're very happy to participate with everybody. Thank you.
Yeah, great. Looking forward to hacking with you. Thank you and welcome. And then hopefully we have Peru, Chiclayo online now as our last hub.
I think Chiclayo and Lima are together.
Will participate.
Oh, they're together?
No, good morning.
Oh, we have Maria.
I think Chiclayo is having a few problems with the connection, but Maria must be already connected.
Okay. So maybe while we are waiting, we'll move to our panelists and panel discussion, and we can say hi to Chikla as and when they're ready. They can signal to the IT team, and then we'll bring them on board. So what an amazing group in so many different countries. And again, huge thanks to everyone who've been involved in organizing this hackathon. I can only top up this amazing group with an outstanding panel, opening panel. And I'm really honored and privileged to introduce our panel, a really distinguished group, and I can call them my good friends. And first of all, Junaid Bajwa, who is the Chief Medical Scientist at Microsoft Research. He's also a practicing physician. He's been doing many things around the world, but he's continued to practice in London as a physician in the UK National Health Service. He is a visiting scientist at Harvard School of Public Health. He completed the leadership program at Harvard, which we ran with the Kennedy School many years back. He's also a clinical associate professor of UCL, University of London, and he is also a visiting associate fellow at the Stanford Center for Artificial Intelligence in Medicine and Imagining and Imaging. And of course, he's at the forefront of AI developments and solutions. So I'll start with Junaid, but let me introduce all the panelists first in the order that we will go. Second panelist is, again, a good friend, Carolina Goich. Carolina is a very well-known and highly respected politician or should I say former politician in Chile. She actually led the Chilean Christian Democratic Party as the president in 2016 and 17, and has been a senator. And she's from the Magallanes region, a beautiful region of Chile, the Antarctica region of Chile. She is now leading SECAN with the new Center for Cancer Health Policy, Cancer-related health policies and control with Bruno Nervi, and is based at Católica University. An economist by training, she was instrumental in developing the national cancer law in Chile, which is a really outstanding example of an inclusive and collaborative process to develop a law, one of the first of its kind in the world. Our third panelist is, again, my good friend Ricardo Baptista Leite, again, a four-term politician, former stroke current. He has actually taken leave from the parliament, from his duties to lead this new agency for health AI, the global agency for digital and artificial intelligence that focuses on healthcare with the aim of actually making a safe AI and digital solutions available to all countries around the world. He is, again, a polymath, and he does many, many things. I don't know how. He chairs the Global Health Policy Lab, which is a collaboration between Harvard Health System Innovation Lab, Charité in Berlin, and also Berkeley Foundation in Germany. He also founded and is the president of Unite, that brings together parliamentarians from 110 countries, very active, and some of in our work at the Global Health Policy Lab would inform the work of these legislators. He also chairs the Center for Global Health at Nova Information Management School, and is founder of Creating Health. He's also a practicing physician. Actually, during the pandemic, he was working in the ENG department. Even though he's an infectious disease physician, he put on his gown and he was working in ENG department in Lisbon. So we welcome Ricardo, and finally our good friend and former student and alum, Beth Ann Lopez. Beth is a serial entrepreneur. She was a founder of Swipe RX, and that utilized an app for pharmacists in Vietnam and Cambodia. Then she established DocuSign, a very successful marketplace that brought together physicians, nurses, and consumers in Vietnam. And she now has a new venture actually on the West Coast in the USA, which currently she's actually developing. She's really passionate about transforming consumer access to healthcare, and she's utilizing AI solutions in her startups. So I'm going to start with Junaid. Junaid, welcome. Great to see you. And you're at the forefront of AI solutions at Microsoft. You see many of these each day, I'm sure, more so than many people have breakfast. So tell us about the frontier. How is that changing? And should we be encouraged, or are there issues? So over to you.
Rifat, thank you very, very much. And I hope everybody can hear me okay. And it's a real privilege to be here with this distinguished panel. So as you mentioned, the exam question that I have a privilege of focusing on is how might we, and I invite you all to be part of this question, an exam question with me, transform the practice of medicine with trusted, reliable, human-centered artificial intelligence. And I say it in that specific way because I don't think it's artificial intelligence for the sake of artificial intelligence. I think when we're thinking about innovation in this space, we have to ensure that the innovations we come up with are trusted, are reliable, and actually make a difference for the end beneficiaries, be they the physicians, the nurses, the pharmacists, the care providers on the one side, or ultimately the patients on the other side. And one of the reasons I continue to practice is I see a huge delta between the innovations I hear about Monday to Thursday with my Microsoft hat, but then when I'm in the National Health Service or in clinic, those innovations aren't necessarily getting to patients. And there is a multiple challenges for us to figure out around the adoption system within which we wish to put these innovations. And one of the reflections I think that Microsoft has had over the last 15, 20 years of kind of looking at healthcare is not just a set of engineering challenges that need to be addressed. You really need to understand the context of the problem within which you're trying to innovate, and also have practitioners that can come and say, well, if we were to do this, does it actually fit within a workflow? Does it fit within an existing workflow and the practice of medicine for a healthcare professional or for an administrator? And if it's too far removed, it probably won't work. And I reflect that it was interesting. I joined during the pandemic. And you take technologies such as telemedicine or video consultations, not a new innovation by any stretch of the imagination, technologies that had been around for about a decade, but it took a pandemic for the professions to agree that that might be a suitable way for us to consult. And that's kind of maintained part of the course. And so I think where we are today is that we have an increasing need for technologies to make a difference in a world and in a context where we have massive supply and demand mismatch. We have a world in which we have increasing comorbidities, increasing aging populations, increasing rising citizen expectations around what they wish for healthcare. Yet at the other side, we have huge workforce challenges. The World Health Organization articulated pre-pandemic that we would have 14 million less doctors, nurses, and pharmacists on the planet than what society would need. And I would argue that in a post-pandemic analysis, I think that's probably closer to 25 million by 2030. So in the next 6 years, we may have a shortfall of 25 million less healthcare professionals, and therefore, what might be the innovation and technology opportunity for us. And the kinds of things that we focus on is really the AI space. And in this post-GPT era that we live in, we're looking at a range of different applications that will allow us to unlock the potential of large language models, frontier language models, to really start to imagine what the future of healthcare could look like. The next 1 to 2 to 3 years for that will probably be non-clinical facing innovations, so things that focus on the burden, administration, arguably the boring elements of healthcare, whilst we're working with regulators, research organizations, and others to truly articulate what the clinical benefits could be. So one example of this that we are looking at the moment and that we've piloted in the UK would be, if you take something such as prostate cancer planning and radiotherapy planning, that process can take an oncologist anywhere between 30 minutes to 3 hours to review every slice of a CT scan and essentially map out tumor versus non-tumor. We've taken a technology from Xbox, adapted it and applied that in novel ways, and we can shorten that 30 to 3 hours situation to something more like 10 to 13 minutes, working hand in hand with an oncologist by the side. It's almost a co-pilot, if you will, for radiotherapy planning. So rather than 6 patients a day having planning done, we could probably look at somewhere more like 6 patients an hour. And if we extend that further, what might we be able to do if we bundled imaging modalities with electronic records and pathology? Might we be able to change pathways of care? So that's one example, and there'll be many others for us to discuss. But we live in an exciting time where almost biology, medicine, and technology are converging. And now we have the tools at our disposal to have huge human impact at the global scale in the future too.
Wonderful. Thank you, Junaid. I'll come back to you in the second round of exam questions about some of the promising digital health and AI solutions that are emerging that might address the challenges that you've identified. But some takeaways, you talked about trusted, reliable, human-centered AI. And you also said the right thing, context. Context is everything. That's what I teach my students. If you don't understand the context, technology solutions will not work. And you also talked about the translation gap, how long it takes to get new technologies into practice. And I think you were quite generous saying that technologies that were a decade old were adopted during the pandemic. Actually, technologies that were 3 decades old or even more were adopted during the pandemic. So there's a real issue in relation to translation gap. And I cannot think of a better person than to ask Carolina. As a legislator, you have all these innovations coming through in terms of diagnostics, health technologies, vaccines, new medicines, now digital and AI solutions. How do legislators react to this incredible collection of innovations that are coming through? And what would you advise innovators who are now going to innovate as part of this hackathon, and also Beth, who's setting up a new venture? I think you're on mute.
Now it's working, huh?
Absolutely.
I said it is not an easy issue to work together with political times and in the political world with scientific, with researchers, and to get in touch with what the patient needs and the time for the patients. I have been working, as you said, in the parliament. I worked 16 years, and I was in charge of the health committee, and I am responsible for more than 50 laws, I think, that have to do with health care. You said the most important, our national cancer law here in Chile. And I know how the political world works, or how it doesn't work, probably. You know? And after that, and in that time also, I work a lot as social worker with civil society. And we work together with you, with Jorge Jimenez in the National Cancer Forum Foundation, working in what today is our cancer law. That is a law that we built bottom up. So I know also the word and the language and how works civil society. By the other side, today I am here in the university, and Universidad Católica de Chile. I'm working in this great project, you say, our SECAN, Center for Cancer Prevention and Control with Bruno, that is the largest research project founded by the National Science Agency in Chile. And our objective is to put together different researchers from different disciplines and work to impact public policies, not only for making a good research and also how in the ministry or politician in the parliament or in other side can use what the researchers are making, are giving. So my main work is to connect all those works. I am also a survivor. 11 years ago, I think, I have my cancer and my treatment. So I also know what the patients and their family feels when you have the diagnosis. I think is the most difficult moment in a cancer. So I think the main issue or the most exciting, probably the most exciting issue today is how we build a bridge between patients, the health teams, scientists, politicians, policymakers, thinking in the better things for people, for their family. That's very exciting for me. And it is possible, but we need to work together. And many times the timeline for politicians is different. For the time for technological changes. Technological changes are faster than the time we need to pass a law in the parliament. You know, here in Chile, we have some laws that have been in the parliament 10 years, 12 years, and then we have two or three governments, two or three presidents of a different party. So that's, you have different authorities and priorities in health. So how to guarantee that the advances we have in technology and for patients have the stability patient needs and the health system needs is one of the problems we have to solve. And also, I think we can deal with innovation in policymakers and politicians in two ways. First, with clear rules, thinking in a long term, with a good ecosystem. That is the best way. But unfortunately, it's not the way we have in Chile and probably in other countries that today are connected and we are working in this hackathon. What happened in Chile probably is more like isolated initiatives that depends in personal or individual leaderships. It's very different from the private sector or the public sector. In the private sector, you innovate more, and the public sector is more difficult. You have many rules and more times and those changes. So how can we put them together in a collaborative way? We have to work on that, and I think this opportunity is very good for that. Especially something I like very much to say is how we put the patients in the center. We often have different expectations among patients, researchers, and politicians. Patients' life in an emergency, especially in cancer, and the scientific world requires time for technological advance, and the political world is slow to translate into laws. So how artificial intelligence or innovation or technology will help us to work together and to make that works in a long term.
Fantastic. Thank you, Carolina. Really incredibly valuable insights. As a patient, as someone who's brought the community together, who's worked across multiple domains, but also as a legislator, as leading a major party, as well as head of the health committee, and very important experience that you've
Sorry, учасники, в таких реаліях ми...
So, dearest participants, we are working in these difficult conditions. You are kindly asked to go down to the shelter. We are going to follow the organizers to the shelter. Safety is first and foremost, so let us do it in the organized and inspired way. We are moving down to the shelter. Thank you.
Будь ласка, важливо, візьміть з собою речі, особливо робочі, тому що наша робота може продовжитися в укритті. Трансляція...
sexually transmitted infections and chatting with this AI bot for literally hours and hours. Some of our top users used it for over 36 hours within a week. And so I had never seen such engagement in a healthcare app before, which usually people use it kind of quickly and then move on to whatever else once they're feeling better. But because of that, I thought that this is something that can really change the way that people access healthcare. And it was working in Vietnam. It was something that we developed, in, as Rifat says, the global south. And because it was such a new, kind of something that hadn't been done before, I saw that there were also very similar issues in healthcare access in the United States. And so, I ended up in the process of exiting DocuSign and starting a new venture that is essentially an AI powered WebMD, connecting patients to large networks of doctors in the US, helping them to navigate their insurance, deal with all of the normal healthcare information asymmetries that normal people get. And I think something for us to be conscious of as we build companies, as we create policies, is the effect that these kind of things can have on normal people as well. Because often I find that creating new things, it's easier to make money solving so-called rich people problems. It's easier to, kind of find a scalable business model, sometimes doing B2B things. There was recently a startup in the US that raised $18 million Series A for digitizing faxes in healthcare. And I'm sure they will, make a lot of money and stuff, but it's not going to be something that directly impacts the end user or the end patient. And so we all have the opportunity to harness this new technology that I think is the biggest thing since the internet has happened, such vast potential to help people. And let's make sure that it goes to patients, not just to infrastructure, to the so-called boring things on the back end.
Yeah, that's wonderful, Beth. I'm going to start the second round, but I just want to try and maybe connect the dots, because one of the important themes that came through in the discussions was this translation gap and the delays in the sort of legislation, regulatory pathways. As an entrepreneur, serial entrepreneur, what were the challenges that you experienced when you were bringing these ventures that were at the cutting edge, where the laws or the regulations did not exist? How did you navigate this space?
Yeah, I think each stage is constant hustle, constant kind of iterating, figuring out what's going to work, and mostly finding things that don't work. I think one of the big challenges in working in a place where there wasn't clear legislation around telemedicine, around home testing, was that there was also, I guess it's not even just the legislation, but it's also just kind of knowledge of different types of interventions by consumers. So if I can give one example, DocuSign was the first private company in Vietnam to do home STD self-testing. We got inspiration to sell these test kit boxes that people could order online. It would have a rapid test for HIV that someone could test for in the comfort of their home. It also included a urine collection cup that people could take, and then we would ship usually via motorbike to a nearby laboratory. They would do the analysis on the sample and then send the result to the patient. And so they could get care very conveniently, discreetly. And that worked really well for STDs. It worked well for COVID during that pandemic. But there are certain things that it didn't work well for because there were, I guess, people were scared. They didn't understand how it worked. So there was a dengue outbreak that was going on in Vietnam. And we saw that there were a lot of people that were worried that their kids were having fevers. They didn't really know what to do. Some people would have to travel from the provinces to hospitals in the cities. That would take a lot of time out of their day, have to take a day or two off of work to go and bring the kid in when they weren't sure if the kid actually had dengue or not, or if it was just a fever. And so we released this home test kit for dengue collection. It was a little rapid test. It was just a finger prick you could do on the kid, and then you would get the results of whether the kid had dengue or not within 15 minutes. And this tech had been on the market for literally decades too. They're the exact same rapid test that was used in hospitals and clinics across the country. We just kind of repackaged it and made it easy for people to use at home. And so we started selling these home dengue test kits. And then all of a sudden, I started seeing some news articles come out in the press. And people were saying, like, very dangerous home test kits for dengue. You should not test your kid at home. They even quoted a doctor in a public hospital who said that using a rapid test kit could cause your kid to go into cardiac arrest. And it was like, what on earth? Like, how can, like, doing a finger prick test cause cardiac arrest in your kid? And we saw that also, like, people were making a lot of money selling these tests that you would have to go to get in the hospital. Usually the markup was 2 or 3 times the price of the test kit, versus we were selling it at about like 1.5x like markup. And so we realized that, okay, we pulled the product, even though it was something that could help a lot of people, because it was easy to scare people. It was I think we didn't do a good enough job educating the market, educating the groups of physicians about the power of home testing. And then I think that was a big lesson learned too, that even if you have something that solves a problem directly, if it's too new and you don't involve enough people, it can still end up failing.
Excellent. Thank you, Beth, for these really wonderful insights and case studies, and some important messages to take away. So you talked about constant iteration, really not just horizon scanning, but actually understanding what works and what doesn't work, and make the decision to actually move and sometimes to pivot. And then you also talked about ensuring user engagement. Not just users of the end product, but also other important stakeholders, doctors, but also even legislators, and ensuring that the innovation is not too far ahead of the game. And you also mentioned, scaling up solutions for everyone. And I think that's the theme I want to pick up in the second round of questions. And I'm going to start with Junaid. Could you tell us some of the exciting AI solutions that are coming through that you're working on at Microsoft? But how can we ensure that not only are these trusted, reliable, safe, and effective, human-centered, but also scalable and equitable? That's a difficult exam question.
It's a difficult question. And I'm reminded of being your student once again when you used to give me essays to do and trying to answer it in the style of an essay. So maybe a few things to consider, and maybe building a little bit off what Beth and Ricardo were saying. So there are probably some things I can share with you, but there are some things that we're working on which are still somewhat in stealth. So we'll just caveat a little bit on that. But the interesting thing in kind of a post-GPT world, if you will, is the GPT technology is democratized for everyone to have access to in every industry, and it sets a new baseline. So overnight, nearly, suddenly, the financial sector, the education sector, the healthcare sector, all industries were able to have, if you will, the power of AI in their hands. And so if the knowledge of the universe can be inside one of these devices, what might that mean for the future of any of these industries? And we would hypothecate that the 2 biggest industries that will probably be most affected by this are probably going to be the education industry and the healthcare industry in particular. And so suddenly, if you've now got knowledge which is democratized from a healthcare setting, I think that changes the game in a variety of different ways. So one thing for us to think about is, if we've got this shortage that we all agree on from a workforce perspective, but we accept that patients and society need access to healthcare, where will they go for information? So already I would have patients coming to me today with from subsectors, so people with relative degrees of health literacy and knowledge coming to me with a search that they've already done on search engine of choice, with a proposed diagnosis that they have, and I have to figure out when they come to see me in the 10 minutes that I have with them, whether that's the right assumption or the wrong assumption. In the future, will they have come already having a pre-consult with a co-pilot and come to me with other information? And again, is that accurate or inaccurate? TBC. But suddenly, the knowledge that exists in the heads of healthcare professionals, I think we should imagine where that knowledge is now in the hands of patients and societies. Does that change the power dynamic that has historically existed between patients and healthcare professionals? One of the things that has set healthcare professionals apart in the past is this knowledge that we have accumulated through 6 years at medical school and then training afterwards. If some of that knowledge is democratized, what does that do to the relationship between doctors and patients moving forward over society? And indeed, could some of this allow physicians to operate at the top of their license? So get nurses, pharmacists, PAs, doctors, and others working at the top of theirs, and access to more generalized information. So there, if we had time, I'd love to do a demo with you to show you how empathic the responses of some of these models can be, changing the empathy in terms of even the conversations and the script that I would have with patients, making it better, perhaps, than it would be in the past. But we have to do everything, I think, with these parameters of responsible AI that Ricardo mentioned. So when I think of responsible AI, I would break it down into the responsible AI from the development side, the deployment side, the impact on the end user, and then the regulation. And if you break down responsible AI even further, you have to think about features such as safety and privacy, inclusiveness and fairness, with a bedrock of transparency and accountability. And when you were talking about biases previously, we live in a world of bias today. Most of the knowledge on the internet, you could argue, is biased. It has gender bias against it. It has an ethnicity bias. So we have that. When we're building models, how do we ensure that we don't propagate some of those biases in our practice and our translation into healthcare? And I think that's a collective responsibility on all of us to ensure that the benchmarking data upon which we do these tests are appropriate. The way that we build models really thinks about bias at the outset and thinks about equity at the outset of what we do. And then we challenge ourselves to do better in the future than we've done in the past. Hopefully that begins to answer some of it. The things that we're doing, we're working on anything that relates to accelerating the pace of precision medicine, thinking about what we might do in the imaging space today, be that for radiology or pathology, thinking about what types of interactions people would have across the human-computer interface. But we're also beginning to do deeper research in the space of responsible AI. What tools and evaluation metrics need to be built into technology? What safeguards need to be built into technology to ensure responsible deployment, again, from a provider perspective, a patient perspective, a safety perspective, to enable regulators to do their work to the best of their abilities too.
Wonderful. Thank you, Junaid, for these really valuable insights and also very important sort of guidance to our budding entrepreneurs and innovators joining the hackathon. I want to move to Carolina. Again, you've heard some of the innovations that are coming through, and you've been a legislator, a policymaker, a patient, and now leading SICAN, the new center in Chile. And you talked about some of the challenges. How do you see the promise of digital health and AI in the context of Chile and Latin American countries? What are the opportunities, and in your view, what are the potential challenges that need to be overcome?
I think we have a lot of opportunities, but we need clear rules, and we need to work in some issues that are not easy in our countries. First thing is data. For us in SICAN, it's very difficult to have good data. And when you speak about sensible data, health data about people, you need good systems that not only have the information of the data, also in a secure way. that can work with the hospital and in my region, that is the southernmost region of the world, you know, is Magallanes and Cabo de Hornos, Antarctica, how you can be connected in other contexts. So I think, and this is useful also for the teams, for the work you are going to do today, that we need to have good data for policymakers and to inform policymakers, but it's also important to develop good, secure information system. That's very difficult. Probably the technological way is easier than the regulatory way. We are a country that have advanced a lot in neural rights and protect them for people, but we still don't pass the regulation for personal data in the parliament. So that's because it's very difficult. And probably many times, if you have more rules, more regulations, innovation is slower. So how can you work with that? You have to protect patients and people, but by the other side, promote innovation. Also, I think it's very important for us in the center and for you as teams to make things that can work in the small world, you know, in the hospital or in the laboratory or in this room, and also can work for all the country. Many projects are very good as pilot, but when you go for large scale, it's different. And I want you to think in that, how the things that work here on a small scale also can work in a bigger scale, if we want to impact public policies. I think also the fact that it's very important to understand very well the problem. Many times we look at the problem and make our diagnosis and find the solution by our own side. You know, I am a politician, so I'm looking as a politician. I am a researcher and I look with that side. So we need to look all the side of the problem. Think of the patient, speak with patients, listen, and really listen different experience about it. So we have a better understanding of the problem before doing a develop or planning how to solve it. I think many times it's very good to use more time for that. And after that, it is easier to go faster in the solution. And also want to say that many times prevention is not the first issue. And it's very important thinking in prevention, especially with technology. We can do many things, and that's for cancer and for other disease. So how can we encourage people to take care of themselves and give tools that are useful, that are simple, that can be here in my smartphone with the memory I have, and you don't need to take out other information, you know, that are useful for people, and also that are useful for the teams, the health teams, and to speak them together, not just for one or the other. I think technology is changing the way we are working in health, and how we understand how we work in health. Then I want to say also that thinking in early diagnosis is very important. In cancer, that's a clue issue, you know, and how we make smaller the time between the first symptoms and the diagnosis, and then the treatment. and how patients can do give better information and work together with the health teams. And after that, just say a sentence about how technology can help us to work with patients and have a better experience about the disease, and work with the family, with the community, to improve patient support. I think we can do many things. We are working in SICAN in those areas, but we have many work to do. So we need you to think, and I hope also to be involved in our project. I invite you, Bruno. All of them are invited to join after this hackathon second.
Wonderful. Thank you, Caroline. As always, fantastic insights. And I'm sure SICAN, which is the first and the largest center for cancer policy and control in Latin America, will be very successful. I'm really privileged to be associated with it. So some sort of nuggets from your last comments, and also echoing what Ricardo also says, sort of regulation as an enabler, not something to stifle innovation or the adoption of innovation. Very, very important. Secondly, and this came through in earlier presentations from Junaid and Beth and others, is think of scale, and think of scale from inception. I think very important message to our innovators and entrepreneurs participating in the hackathon today. And something that is really important and close to my heart is, define the problem you're solving. Whose problem are you solving? What is it precisely? Saying that, mental health is a large burden for the world. That's like the Pacific Ocean. So be very precise about the problem you're trying to solve and understand it well. And that requires listening to users and stakeholders, and spending time and developing solutions that improve their experience, as Beth did with the solution that she developed in Dokusan. And maybe a final word is focus on prevention and early diagnosis. This is where the huge gaps are. And this is where the big challenge is, of course. How do we change human behavior? How do we motivate individuals and health teams to change the way they work, as Junaid said, to enable them to, in terms of health workers, to operate at the top of their license, but also change the way they work. That's not easy to do. And I can say this as a physician. We are not programmed to change easily. So fantastic insights, thank you. And very good segue to Ricardo. And I know, Ricardo, you're passionate about scaling up innovations to benefit many, but also to ensure that these solutions are ethical. So how do we ensure scale? How do we ensure equity? But how do we ensure that the solutions are within the sort of ethical frameworks that guide service provision?
Well, that's a major challenge, and of course, part of our mission at Health AI. But if I may, just taking a step back after listening to the different comments, I think it's very important in an age when we're all, in a way, pushing for universal health coverage, understanding that right now what is happening under that umbrella is we're seeing a lot of old technologies and old management procedures being exported from high-income countries to low and middle-income countries. And so, in other words, we're exporting broken disease-driven models to countries instead of using the power of technology for low-resource settings to actually leapfrog towards the future. I too passed in as policymaker, and I know how it's easier to inaugurate a new hospital and be on the front page of a newspaper instead of doing the digital transformation that a health system actually could benefit much more than building an old kind of edifice or building within your health system that probably you don't even have the human resources or the capital to maintain in the long run. I think that when we talk about universal health coverage, I think it is very important that we ensure that we look at this in a way that in terms of outcomes. What do we want to achieve in terms of better health outcomes for every citizen, including those most vulnerable, those most marginalized in our populations, and not just trying to replicate broken models from rich countries into poorer countries. The second issue is regarding the way health systems are uptaking technology. Sadly, even among richer countries, I'm originally from Portugal, and we see how a lot of the money that's being pumped into a so-called digital transition is no more than actually buying computers or investing in technology that replicates analog processes into a digital format. That does not change anything. On the contrary, it gets people very angry because they spend much more time now with digital tools to do work that they used to do faster in an analog world. And so that is not what we want. And that is a wasted opportunity and a tremendous waste of scarce resources. And so what we should aim for is a digital transformation in the sense that digital technologies, and going back to Junaid's comment, these digital technologies are a means and not an end. These digital technologies are a means towards making a more compassionate, more human-centric health system by freeing up our healthcare workers, by freeing up the human capital in our health systems so they actually have more time to be with patients. So we can get the screen out of the way between the physician and the patient, and that we can reconnect humans within our health system. We talk a lot about healthcare. We typically focus more on health and less on care. We need to bring compassion back into the conversation. And so that being said, going to your question directly, it is extremely important that the way we deploy technologies, and particularly now with the rise of AI, which I believe over the next 2 decades, when we're going to stop discussing the separation between digital health and AI, because everything that's digital is going to have an AI component. And in that future, we need to make sure that from the beginning, from now, we are building up an ecosystem that is designed from start to have those principles that we were all discussing of inclusivity, of fairness, trustworthiness, transparency, making sure that safety and data protection are all there. But doing this in a way that is bottom up, in which everyone is involved. That is why we believe that more than talking about a regulatory environment, we need to really create an ecosystem that fosters the technology in a way that it is actually accessible for all, but also benefits everyone. And that depends on design. Maybe I'll just end on this point, Rifat, to reinforce what I'm saying. There's a very interesting book called Power and Progress that looked at the evolution of technology over the last 1,000 years. And one thing that has happened over those 1,000 years is the people who develop the technology typically say this technology is going to save the world. What normally happened was that it wasn't exactly that. The technology typically benefited a very small portion of the population. However, there were some examples throughout those 1,000 years of history in which technology actually had a global impact throughout all of the population. The difference was because the technology was designed from its inception towards its deployment into the market in a way that it was ensured to be fair and equitable by design. And that's why we believe it is so important that while we're still early in this new wave of AI-driven technologies, that we get this right. And that's why we at Health AI, we like to say AI can save lives. Let's get the regulations right, which in other words means let's make sure we build an ecosystem that can foster innovation, can foster access to technology, can lead to trust, that leads to adoption at the same time that we're keeping citizens safe and building a world in which technology has the end game of leading to better health outcomes for all.
Fantastic, as always, Ricardo. Some very important sort of nuggets. As Junaid also talked about democratization of knowledge, and this is what digital and AI solutions will enable us to do. And you said, this is going to be a critical component of a new ecosystem that is where the policies and regulations are more enabling than hindering. An ecosystem that is inclusive, that is very much person-centered, and very importantly, benefits many, and not just a few. We talk about not just value for money with these solutions, but actually value for many, that including those who have difficulties in accessing services. And you said the solutions need to be equitable by design, very important. You also said that it's very important to focus on problems, but also think about the outcomes that the solution is going to achieve and who's going to benefit. I think that's a very important message to the to the participants. And finally, a very interesting observation that this digital and AI, these are not separate. Every digital solution will have an AI component. So we should talk about this convergence that is happening. So really fantastic insights for our panelists, for our participants. So to close the panel, I'm going to ask Beth, as a serial entrepreneur, you've heard our distinguished panelists, including yourself. What kind of advice would you provide to our participants, especially ensuring that the solutions that are developed are going to be equitable at scale, and some of the challenges that you might experience? How should they negotiate these challenges?
Yeah, so I think when you are starting a company, you should think with a really big vision on how do you want the world or the health system or society to change. Because if you start with a really, really big problem, it will be easier for you to attract wonderful talent. It will be a North Star to what your company is trying to succeed at. At the same time as having a big vision, start with a very specific, small problem for a very specific group of users that you want to solve. Because if we take a huge vision like improving healthcare access, and you try to do everything, you try to influence like the physicians and the kind of like back end stuff, and then you try to do some consumer sort of like play, and then you also get into another kind of thing. You end up creating a solution that everyone thinks is like okay and no one is excited about, which is it's much better to have a small group of like fanatical users in the early days, because it means that you are solving a real problem for a real group of people. And then you can worry about scale after you get those, say, maybe first 10 fanatical users. Then you can grow it to 100 fanatical users by talking to them, really understanding what their issues are, understanding what part of your feature set is the most impactful for them. What is the need to have? And if you can get to 100 users, you can get to 1,000. And from 1,000, I mean, you can literally get to millions. But it starts with solving a very specific problem, but always keep the North Star and a larger vision for what you're trying to accomplish in mind.
Great. So focus, always think about the purpose, the North Star, don't deviate from that. Iterate in the process, but never lose sight of what problem you're trying to solve and the outcomes you want to achieve. And I like your message regarding scaling. If you reach 100, you can reach 1,000. If you reach 1,000, you can reach 10,000. And it's this sort of a logarithmic game. It's not a sort of a linear process. So very, really great advice to our participants. So I'm going to share my presentation once again. And the purpose of this is to share with you again our distinguished panelists and ask all the participants to join me in thanking them for their words of wisdom and them sharing experience with all the participants. So huge thanks to Junaid, Carolina, Ricardo, and Beth. Thank you for making time, and thank you for joining us as part of this process. And before I hand over to Shay for the next steps, I would like to invite the Chiclayo hub from Peru. Hopefully they're now online and they'll be able to join us to say hi. Chiclayo, are they able to join us to say hello? Yes, oh, okay, great. So maybe a few words.
Hello, good morning.
Hey, good morning.
Hello, good morning. Here in Chiclayo, this is the public. They are the state in attention for this presentation. Thank you very much. We are very pleased to listen, and they are the expectation of Chiclayo, Peru.
Wonderful. Welcome, Chiclayo, Peru, and we're really delighted to have you as one of the hubs, and look forward to your participation. And I saw earlier in the message that Kiev hub, they had to go into sort of safety because of sirens, and then glad to hear that they had to go to shelter and they're now back and safe and sound. And we really appreciate them joining this hackathon in such difficult times. So please again join me in appreciating Kiev and Ukraine joining this hackathon. And finally, I'm going to hand over to Shay. Again, huge thanks to everyone that made this hackathon possible. And I'm going to ask Shay to tell us about the next steps. Thank you once again.
Thank you very much for your plea.
Yes, no, thank you, Rifat. And this brings us to an end, I think, of the official welcome for the hackathon. As well, I feel very inspired by this, and I think it's a good program. So in terms of next steps, each of us will go back into our respective hubs and begin with Hack 101. So this will be the end of the panel and the welcome. We won't have time to reconvene again, but we'll go into Hack 101, mentoring, and you'll work in your respective groups. So from us at the Health System Innovation Lab, we'd like to thank you for your time, and we look forward to seeing all of you over the next few hours. So thank you.
And happy hacking, everyone.
Bye-bye.
Bye.
Come down now because we're going to do a brief presentation from me where I talk about what these sheep are about. But also I'll be on the judging panel on Sunday, so I'll be giving some hints and some suggestions about some of the aspects that I'll be looking for on Sunday. So please, if there's anyone missing that you know of, tell them to come back, and maybe if we let the teams bring them back in over here as well if they're next door as well. Okay, guys, so one second, we're having fun with technology today. And we go backwards here. Okay, because my colleagues that you got to see presentations from before on NCDs and mental health, they were so passionate about their areas of work. They went a bit over time, so I'm just going to be talking now briefly to you guys about AI and health, just for 10 minutes, and then we're getting back to the program. But just first up, my name is Dean Cairns. I'm with the WHO Kiev Country Office. But what you really need to know about me is that I'm from Australia, and I own these 5 sheep that are back home in Australia, and they're currently sitting on a hill in the countryside and taking care of my house. And I love Kiev. I've been living here for a few years. It is my second home. I love this country to the bottom of my heart. But I do miss my home sometimes. I'd miss my friends and family, and I miss my sheep as well. So, recently, some of my friends got together, and what they did, as a surprise for me, is they actually came up with a chatbot that mimics my sheep. Because they wanted me to feel more connected to back home, they wanted to have some fun with technology, but they fed this chatbot with different information about my sheep, about myself, about my property, about my home. And you know, I can sit there at night now, when I'm in the shelter like we are now, and thank you very much for all of you all making your ways down here, and especially the organisers for making such a comfortable space. But when I'm in the shelter at 3 o'clock in the morning now, I can have a chat with my sheep online. I know this sounds crazy, I know it's pretend, but it's the wonders that does for my mental health is incredible. It allows me to feel connected with back home, it allows me to hear some jokes from my sheep, and I pretend that they're on the other end, on my hill, writing on their computers. But why I'm telling you this is because what has made this such a special use of AI is that my friends mix their skill sets, mix their personal story of us, mix their knowledge with the technology. For me, AI and all this conversation, there was a lot of really good points they were making on the panel discussions before, but AI is super, and I'm breaking this as well. I really don't like about these things, do I? Can I get one more of these as well? All right, so, thank you very much. Just trashing all the equipment here. Where was I? So, what they're doing is mixing their skills with the technology and their personal story with the technology to provide me with a very personal product. And this is the real game changer, I think, because AI in itself is pretty boring for me. It comes up with a lot of the things, you put it in there. If you put no effort and skill sets into mixing your own story, your skills, it gives very rudimentary, basic answers. And so this is my advice to you when working with technology in general and AI moving forward. It's about how you take your own personal skill sets, your team skill sets, your skill sets, and how you can make it your own unique product. And that is the key thing for me. And that's where my crazy sheep on the hill in Australia, I can have a chat with them every night now. And none of you could have invented that product for me, but just my friends and family could do that because they knew me. So I just wanted to touch on that because I think that's something that's often missed with technology in these conversations about how we make it our own personal journey, and that's where true innovation comes about for me. So, moving on. AI, it's everywhere. We know this. Half my emails I get now at work sound like Shakespeare has written them. Everyone's putting it through ChatGPT and sounding like they're Hemingway and everything, and it's very confusing. but it's incredible what it's doing to making our everyday work life more productive. If it's writing emails, if it's creating presentations like this, if it's applying for jobs, but it's also changing the systems that we're working with as well. And it's happening in Ukraine in terms of reconstruction efforts, in terms of the planning out new effective uses of the energy grid. They're using AI technology to strengthen these fields. But for health in particular, it's in a unique space because this sector in itself has a lot of risks and opportunities that are important for how it uses AI technology moving forward. And I think this is, I was trying to come up with some fun examples here about, how risks and opportunities evolve. Because, everyone always talks about risks and opportunities, blah, 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 with stuff, but it's more about how they change over time. And I remember thinking, I don't know if your parents, when you were young, they said, don't get too close to the TV. You'll get square eyes. I don't know if it's the same in Ukraine. It was in Australia. My mum would hit me over the back of the head. So Get away from the TV, because you'll end up going blind. And now, we're literally attaching the TV to our head. And you can see how technology changes and the messaging has to change, because we are, with these new virtual reality equipment, we're putting the TV literally in front of us, and we wonder what our parents would be saying to us now. But this technology, it's providing us a lot of opportunities as well. Because now with this technology, we can also allow not only just to watch Netflix in this amazing virtual reality, but it allows doctors to perform and to practice operations before they go into the surgery room, to practice on real-life data and dynamics of what patients look like before they go into a operating theatre. So that would basically contribute to them having less chances of error when they actually have to go and do the task at hand. So this is a point that I'm trying to make here, is that things move on, and those risks, they're there, but they change. And I think that's something that we have to be particularly careful about with AI in health, because there is so many different aspects in terms of how those risks are going to be evolving over the period to come into the future, and we have to be aware of that. And those risks have to be managed. So if we listened to our parents 20 years ago and didn't keep away from the TV, we would probably, and took it very seriously, we would never have invented this type of technology that's going to be providing all these benefits to how doctors perform operations and practice their skill sets and make us safer in terms of delivery health services. So we need to keep that in mind when we're thinking about health and AI. We need to be able to work with those risks, because they change over time and we have different risk appetites. So yeah, just a few key points there on that. This other part of it, which I think is also about the opportunities which have to be gained from this process. This technology is in its very, very early stages. We don't know where it's, we haven't got a full oversight of the potential of what this technology is going to be doing over the long run now. And you need to factor that into your planning and your thinking in terms of what you'll be producing over these next few days. And I'll briefly touch on this example. I always talk about it, the iPhone example. We all, back in 2007, and I'll be like the panelist members before who were flashing around their iPhones, but back in 2007, everyone got obsessed about iPhones. Everyone started buying iPhones and ditching their Nokia 3310s, and it was the new fad. Basically still to send text messages and hang out on apps, but this was the sort of space that everyone was excited about. And I think, somebody told me recently, and this is the example I want to talk about, if you had bought every iPhone up until now, and I converted it to hryvnia for our sake, you would have spent 660,000 hryvnia on buying iPhones up until today. And you would have been sending text messages, very similar to what you did with your Nokia 3310, communicating with family, giving calls, all these sort of things. But you'd have a flashier, cooler product, and you can show your friends, and we all get sort of sucked in with the marketing. But the opportunity that arose from that technology, if you'd taken that same money that you've spent, and hopefully no one has bought every iPhone since they came out, but if you'd taken that same money and invested it in Apple, you would now have 14 billion hryvnia in your bank account. And it's just to show that there was a revolution in technology, but how we approach it, how we consume it, is such an important thing in terms of our practice. If we just snap it up and say, the new flashy thing, it can be distracting to actually the real benefits that are out there. There's always some way of looking further afield and seeing how do we look at the other opportunities that are not the obvious ones ahead of us in terms of picking up the mobile phone. What are other things we can do with our resources, investing? And I think this is the key part in terms of health. It's longer-term investments that are required. It's not just the immediate gains, it's that longer-term aspect in terms of what we invest in. All right, that were a few key quick pointers. Look, there's many, many different uses, and they talked about it in the panel, so I won't bore you again covering all aspects of this, but there is many uses for AI in the health field. Obviously, one of the key ones is in terms of the immense amounts of information that is out there. How do we work with electronic health records and the analysis of that information, making that information more available, making it more available at the right time for healthcare workers? And AI can definitely assist with that. There's also the diagnostics element. How do we make better conclusions from that data to be available at the right time for health practitioners? How do we ensure that the diagnostics is more tailored for that individual based on their specific needs? There's the chatbot, there's my sheep chatbot, but there's also the WHO chatbot, there's all these other ones more professional, very useful resources for people to engage in to work out certain level of support, the level of support that's needed within different fields, and a good starting spot. There is also attempts with AI in terms of how do you connect services better. Healthcare can be fragmented. It can be hard to link up certain services to other. So in terms of AI, how do you help you navigate that platform and those discussions? But I think, the core part for us is really the information aspect. How do we make use? Because health is such a personal story that's captured in so many different ways. How do you process that information to come up with new insights into your practice? And I think that's something that hopefully many of you are going to be touching on in your work in the coming days. But then there's the ethical issue. And this is the risk aspect of what we're thinking about here. They talked a lot about the positives in the past panel discussions, but now we also need to look about the ethical issues around AI and how they are going to be affecting these different ideas that you're going to be coming up with. Now, WHO back in 2021 came up with a very good guidance piece on this in terms of some of the risks that they see in the use of AI in this area. And, just to touch on a couple of them, it's in terms of the data that it's using, it can provide in terms of solutions for health needs. They can be inaccurate sometimes. They can be incomplete. They can be based on biases. Where is that data being pulled from? It's not coming from nowhere. It's coming from certain sources, and you have to keep that in mind all the time about biases and about manipulation. Now, there's also a lot of issues around privacy. I have issues around, the privacy. If I'm feeding my data into systems, what is that? If it's learning from me, where else is it using that information in other platforms? There's also issues around the degradation of skills of health workers. People are getting a bit lazy with AI. They use, we can just put it into the chatbot and do these things. What's the longer term consequences of this in terms of healthcare workers saying, okay, I don't need to know about that area because ChatGPT will know it for me, or the AI chatbot can do that piece for me. And then there's also the risks to service delivery outside of the healthcare system. Everyone feels like a doctor now. I'm sure all of us have gone on Google at some point and looked up a diagnosis that you've put in your symptoms and you've come out that you have Ebola or something like that. And there's a problem that everyone starts becoming a doctor when they're not. And when you have these AI tools that are acting like doctors and acting like people, it can give the wrong impression. So just key points to keep in your thinking over the coming days in terms of the ethical aspects of using AI in your planning and programming. And I think this, to finish up, 6 key principles that I think you need to keep at the mind if any of your key, your ideas that you're working with. And please take a photo of this because, hint, hint, it's something we'll be looking closely at. But how do you maintain the autonomy of the individual in your work? How do you make sure that you're keeping a human focus to what we're doing? And a lot of the presentations that we started with talked about this, that we're talking about real people here, and they have to interact with, they have real problems that matter to them, and the services and the ideas that we're coming up to need to speak to that. At all stages, we need to promote the well-being and human safety and public health interests. And we also need to ensure the transparency and the explainability and intelligibility of what we're doing. Some of the things we do, like we get working on it and they become super, super complex. And so if you can't explain it to your grandparents, then how are they going to feel when they're interacting with this service, policy, project, whatever you're working on, if they're not being able to interact in a way that makes sense to them? Then there is the ensuring inclusiveness and equity. With how people with who don't have computers, who don't have access to mobile phones, who don't have access to power, how are they going to be interacting with these products as well? We have to ensure that the services and policies and practices that we're developing are accessible to all across this country. And then we finally need to promote AI in a sustainable way. Like I said before, AI is constantly changing. We are in the early stages. There's a lot of unknowns. We need to come up with ways that are embracing those possibilities and solutions, but also keeping in mind at all times of how fast this environment changes, and that if you're basing something on the new technology of today, it might be irrelevant tomorrow. So you want to go back to those core principles of AI and healthcare and keep on coming back to this. What does it mean to the individual? I believe that's it. Yes, so that was the main pieces from my side. Just very quick overview in terms of health and AI, but just to reiterate, it's going back to my sheep. It's how you guys bring your skill sets and your own vision to this, because that's what I'll be looking for on Sunday. Like, what is your personal story and how you've made this into these products? Because anyone can go off and, even from the previous presentations, they're very, you can read any Wikipedia article now. You can get ChatGPT to do the work all for you. But, and people are like, oh, okay, yeah, we could do that. It stands out so much. Because everyone knows now an email that's written by ChatGPT. Everyone knows an essay that's written by ChatGPT. You can tell the language. But if you spend time mixing your skill sets with programming, how it's worked, mixing your personal experience of how a system has functioned that you've interacted with, that's when you're going to come up with really, truly innovative solutions that are going to be beneficial to this country, which is very much needed. So very excited about the next couple of days. Very excited to see what you come up with on Sunday. And a big thank you from my side, and I'll be passing it back to the moderator. All right. Thank you, everyone. Cheers.
Отож, учасники, як настрій? Юху! Так, десь тут рішення буде максимально ефективне, максимально переможне. Як настрій, панове? Все, рішення тут. Так, насправді в цих умовах, в умовах укриття, наша енергія, наш настрій, він вирішальний. Тому ви просто можете зараз про себе подумати, я на цьому наголошую, подумайте про себе, що ви надзвичайно сильні. Знаєте, яка найголовніша риса, найголовніша якість, найпрогресивніша в сучасному світі? Це адаптивність. Адаптуватися. До таких умов мало хто в світі може адаптуватися, відверто. І не дай Боже, щоб до цього приходило. Але ми вже адаптувалися, ми українці, ми з різних міст, у нас всеукраїнський хакатон, міжнародний, як ви бачили, та і Бостон. Чули, який Бостон гучний був? Ми як, дотягуємо до Бостона, ні? Ну, давайте трохи настрою дамо. Хакатон! О! Як на мене, трохи гучніше. Словом, з цього моменту буде розпочинатися практична робота. Ми переходимо до формування команд. Перед тим у нас є ще одне відео. Ми подивимося вітальне відео прямо зараз. І після цього перейдемо до формування команд і вже максимально включатися в роботу, в вашу креативну, ідейну і переможну роботу. Цього вам усім бажаю. Отож, я прошу, будь ласка, зараз вітальне слово. Доктор Віктор Ляшко, міністр охорони здоров'я. Увага на екран, прошу. З відео? Є? Чи затримка технічно? Є, так? Все, супер, будь ласка. Доктор Віктор Ляшко, міністр охорони здоров'я. Хто добре англійську Там субтитри.
Наприклад, фармакології чи будь-якої з медичних наук. Фахівці різних сфер і професій. Сьогодні IT і охорона здоров'я є абсолютно нерозривними поняттями. Розвиток цифрових рішень не лише пріоритет уряду, а й один з основних трендів розвитку систем охорони здоров'я на світовому рівні. Рівень впливу діджитал-сфери на розвиток і покращення надання медичної допомоги аж ніяк не менший, ніж розвиток, наприклад, фармакології чи будь-якої з медичних наук. Фахівці різних сфер і професій можуть пропонувати і допомагати розвивати цифрові рішення в сфері охорони здоров'я. Від порівняно простих застосунків, що допомагають нам слідкувати за власним здоров'ям, рівнем цукру в крові, чи виховувати здорові звички або інформувати людей про загрози, і до використання штучного інтелекту, який здатний знаходити лікарські помилки або допомагати діагностувати хвороби на ранніх стадіях за найменшими ознаками. Ми у Міністерстві охорони здоров'я посилюємо політики, які спрямовані на збереження і зміцнення здоров'я, захист здоров'я і промоцію здоров'я на усіх етапах життя людини шляхом міжсекторального підходу, що передбачає залученість різних стейкхолдерів. Адже здоров'я – це не тільки про лікування, а у першу чергу про попередження хвороб і створення умов середовища, що сприяють здоров'ю, ранній діагностиці і своєчасному лікуванню. Ми працюємо над системними змінами. І нова мережа лікарень, а також нова система громадського здоров'я будуть вимагати ефективних інструментів для того, щоб наповну продемонструвати свої можливості. Окрім того, завдяки отриманню статусу країна-члена на новий рівень виходить партнерство, професійна співпраця і обмін інформацією з країнами-партнерами Європейського Союзу. Тож бажаю успіхів усім командам. Будьте рішучі, сміливі і креативні у своїх рішеннях. Адже інновації – це те, що також рухає нас до перемоги. Слава Україні!
Панове, отож, ми зараз ще раз організуємо атмосферу, щоб ті, хто з нами був на онлайн-трансляції, зрозуміли, відчули, що ми налаштовані серйозно. Дякую усім, хто нас дивився в онлайні. Ми з вами прощаємося до неділі о 14:30. На фінальних пітчах ми побачимося. І пряма трансляція, вона буде доступна на сторінках Бюро ВОЗ Україна, Сівіта та Радар-Тех. Тому відчуйте, як у нас всі налаштовані на роботу. Ваші оплески всім, хто офлайн. Хто з нами був онлайн, ці оплески для вас. Дякуємо. У нас розпочинається тут дуже активна робота. З вами побачимося у неділю, 14:30. Заплануйте. Дякуємо вам, що були з нами.